Hello and welcome to week 4. We are really going to kick off some of the most exciting pieces, I think, about the work that we'll be doing this semester, which is around building the case for quality. Now that you've put together your strategic process framework and you understand that underlying bedrock of mission, vision, and values, having that plan and putting all of those pieces together, looking kind of big picture at what it is that you might be assessing your organization or your workplace for. This week, we're going to really focus on a specific aim for your proposal. So a lot of the reading will be focused on that, and there is an assignment this week around designing an aim and helping your peers as well really clarify what it is that they're trying to accomplish. I would be remiss not to kind of back up just a little bit and talk about overall our course objectives are really, and I have to look at a couple of notes, are to explain the economic aspects of healthcare reform in the United States. So week 1, as we reviewed that ACA and the number of changes, and hopefully in our discussions are continuing to explore the impact of reimbursement in the current financial climate in the U.S., that will be an objective that's easily met. We are going to also, from a course standpoint, be interested in the market forces that affect healthcare costs and availability. Now, market forces, what in the heck is that? And I want you to think about how quality impacts that. We are going to have a really interesting article that is attached to this week's readings that I really want you to dive into. This might be one to print off, read, highlight, look at, really kind of go over more than once, as it is going to introduce quality in our healthcare environments as a fixed cost. I don't know how much we'll have gotten into fixed versus variable costs at this point in our studies. This is difficult to kind of lay this all out in advance without enough feedback from you, the most important part of this equation, but I will go over right now. When we build budgets for our units, for our divisions, for our organizations, we know that there are fixed costs, which are costs that are going to happen regardless of what's going on. So in a nursing inpatient unit, you might think about a health unit coordinator or whoever it is that answers the phones at the central desk. Regardless if you have one patient on the unit or if you have 42 patients on the unit, you need one person to be answering that phone. You might need more than one if there's 42, but the point is, regardless of patient volume, regardless of patient activity, there is that is a fixed position, that health unit coordinator, whoever it is that's answering the phone. Then there are variable costs. So that would be nurses, PCAs, the other people, the respiratory therapist who flex. So what we need from a staffing component is really based on patient demand, the number of visits that we have in the day, the number of OR cases that we have in the day, the number of patients that are in our unit. And so that varies because there could be times where we have lots of patients and lots of visits and lots of operations, and times where we have fewer operations, fewer patients, fewer operations. So that is the variability. We've got fixed and we've got variable, all dependent on what our supply is demanding from us. The concept of quality as one of those fixed costs, there's electricity, there's water, there's equipment. You know, we think about these fixed costs, the things that are going to be there regardless of what's going on from our patient care standpoint. The rent, these pieces, to put quality into that kind of bucket. So when we look at that course objective around the forces that affect healthcare costs and availability, we are going to make a definite link to quality with that this week. We also want to be able to analyze and describe the connection between quality patient outcomes and the financial performance of our organization. And so that really is another key part of what we're going to be looking at. You've done that overview, that strategic process. We're going to work this week on the aim, and then the following week, we're really going to dig into a SWOT analysis, but a SWOT analysis that's specific to financial performance indicators, okay? And then just to be able to be continuing to work on articulating this business proposal that you are going to be working on in this time period. So hopefully this all is starting to make sense and tie together. If it's not, please reach out to me. I am very much looking forward. This is, I think, the key of what we do. The other piece of what the article that's included in the readings this week will do is maybe irritate you. I think there's some, I'm hoping for a good debate, let's just put it that way, some good discussion, and as we move through that and move forward. So have a great week. Please reach out if there's anything I can do, and I look forward to talking with you in the discussion. Let's set those aims.